Good evening, friends. Welcome, welcome, welcome. Welcome once again to Monday Epi Live. Today, I'm going to take up a very, very interesting topic. A topic which is very close to my heart, a topic on which I've written a book as well. It is about the pricing, the pricing in a dental clinic. So, of course, not the full topic. I'm going to take up a very short version of it in today's live. Uh, slowly, we are completing our journey towards 26 episodes intended to do for the first half of this year. So then we'll be winding up. Yep, it is live. Just wanted to check it online. So, friends, allow me to share my screen so that I can begin today's proceedings. Thank you. Okay. Yes, today is episode number 15 of Miraculous Mondays or Management Mondays, as we all know. So let's begin the proceedings today. All my presentations always would begin with thank the Lord Almighty, who's given me much, much more than what I deserve. This is my brief CV. You all are aware of it by now, and I hope gives me a little bit of authority in sharing a few things with you guys. Courtesy this. So today's topic is about pricing, price shift in the clinic, upward or downward. Of course, it is not always upward; it is downward as well, many of the times. But is that shifting pleasant? Do we have to be fearful of that? And why don't dentists take the upward step very often? The problem in most of the cases is that the upward also does not happen, and downward may or may not happen. It stays a flat line throughout for many years in a clinic. It'll do nothing. It'll do nothing but decrease your profit margins. So you have to think about it. Whatever costing was there at exactly a year back, or maybe just go back 2 years, pre-lockdown time, 2020, Feb, March. Are the prices same today? Let's not talk about the living cost. Let's not talk about the, you can say, your routine cost of survival. Let's talk about just limit ourselves to the clinic cost. Are the materials at the same price? Are your lab bills at the same price? The answer is a big no. There have been so many new things which have been added to the disinfection and the sterilization component of the clinic. There have been many gadgets added. Of course, you would say there is no maybe a maintenance cost, but a depreciation cost is there in that regard. Then there has been a big jump in the pricing of the basic things like gloves and masks, the basic things. The attire has changed, the scrubs have taken over, the gowns are there. In many places, even till today, I had a talk with one of my friends this morning only. They're still working with PPE as well in today's time. They're still working with PPE. They said now it has become a habit. Forget it. I'm just mentioning a few things, using or not using, but most of those things have added to the clinic costing. So if you are not increasing your prices annually or at least once every 2 years, then what are you taking home? You are getting a cut into that. And that is where the problem is. But the shifting is not pleasant. At the back of the mind, the fear is still there. Agar price bada, patient gaya. As if the patient is coming to you only for only for price. Where I mentioned our is the dentist mindset is that we keep on believing that health is just, you can say, cost related thing. The patient has chosen you for cost. Let's suppose a scenario where you do a shabby work. I hope none of you are doing it. Shabby work in terms of disinfection, sterilization, in terms of cleanliness, in terms of not maintaining a proper congenial working atmosphere in terms of cleanliness. You're not doing that, but you're priced slowly. Will you have a bumper OPD? Absolutely no. You need to understand that pricing is not the criteria. There are multiple criteria, but we have made it on our mind. that yes, pricing is the criteria. Patients have chosen us. Patients have so many variables to choose us. Can be proximity, can be your behavior, can be your internal marketing factors, can be your cleanliness, can be your disinfection, can be your way of working, can be your treatment protocols, can be your treatment planning, can be your record keeping, and what not. Trust me, these factors are more important. Nobody would search for a cheapest dentist or cheapest endodontist in the town. They will always search for the best, or the lowest for the best. The lowest root canal solution, the best for that best is a destination altogether. We need to understand this part very, very clear. So the price cutting is not a question, is not an option which should be resorted to, because I have to make that judgment firstly in your thoughts, statistically speaking. If really worried, then the question becomes whether you amplified the cost of there will be the times when dentists feel to change their prices. But then the ratio comes. Impact on profitability of any proposed price change. ये बढ़ेगा तो कितना profit बढ़ेगा? Be it upward or downward, of course. Many people do not take into account the costing part primarily, as I've discussed in the costing sessions many a times. But what is more important over there is that the volume of the services being provided. For example, if somebody is doing maybe one denture every 2 months, he has work, he has ample work, but by luck, by chance, he doesn't like dentures also, he doesn't have dentures also, denture patients walking in. So he does one denture every 2 months, saal ke 6 dentures. Let's suppose he's charging 10,000. So total revenue per year is 60,000. So if he decides that, yes, I will need to raise this price. From now on, my denture is 20,000. So even if that volume of patient comes down by half and the price is 100% increased, 6 में से 3 लगे साल में, जो 2 महीने में एक लगता था 4 महीने में एक लगा, the revenue is same, but the costing is now half. The revenue is same, the costing is half. The volume plays a big role. That is where I always try to make the colleagues understand that whenever you have to raise the prices, raise in those services. Again, ignore this denture example. That was just to make you understand. Make a raise in those services which have a better churn out ratio. Let's suppose the same denture example. You decide that I'm going to raise my charges by 20%. Now your 10,000 denture becomes 12,000 now. Okay. The volume comes down. Let's suppose it again comes from 6 to 3. Now your revenue is actually 36,000 rather than 60,000. Of course, the costing is also decreased. But you will say, मेरा तो 24,000 का नुकसान हो गया प्राइस रेज करने के बाद. 10,000 का डेंचर अच्छा था. Wrong mindset. Always increase the services in that regard where the churn out ratio is more. हम लोग जो चल रही होती है ना चीज, जैसे रूट कनाल, लेट्स सपोज यू डू 20 रूट कनाल्स अ मंथ, यू डू 50 क्राउन्स अ मंथ फॉर एग्जांपल, उसको तो लोग टच भी नहीं करते. एंड दैट इज वेयर द प्रॉब्लम लाइज. डेंचर, लेट्स सपोज आपका वॉल्यूम नहीं गिरता है 20% रेज के बाद भी, अगेन सेम एग्जांपल, व्हाट इज द इंक्रीज इन द रेवेन्यू? 12,000 रुपीज। 60,000 आ रहा था 6 डेंचर का, अब 72,000 आएगा। साल की इंक्रीज 72,000 माइनस 60, 12,000, 1,000 पर मंथ इंक्रीज एनुअल। 20% आपको लगता होगा बहुत ज्यादा रेज है, 20% करके भी you don't arrive at that volume, or you don't arrive at a desirable number, just a 12,000 rupees profit. So focus your raise on those things which you do more. Colleagues डरते हैं, as I said, shifting is not pleasant. जो चीज अच्छे से चल रही है उसको मत छेड़ो, वो जैसा आ रहा है चलने दो, चाहे शाम तक बर्नआउट हो जाए, बुरा हाल हो जाए, बच्चों के साथ बात करने की हिम्मत ना बचे क्लिनिक के बाद, लेकिन ये काम उतने कॉस्ट पे करते रहे। वॉल्यूम है, वॉल्यूम है। अरे होलसेलर नहीं हो भाई आप, यू आर अ सर्विस प्रोवाइडर एंड दैट टू अ एलीट वन। होलसेलर के पास लॉजिक होता है ये वाला कि वॉल्यूम ज्यादा आ रहा तो उस चीज को मत छेड़ो, उतने प्रॉफिट से काम चला लेंगे। अ रॉन्ग अप्रोच। इवन अ 10% रेज, स्पेशली अगर आपकी ये सर्विसेज जो आप मेजोरिटी करते हैं, लेट्स सपोज क्राउन ब्रिज ओनली, दे कंट्रीब्यूट टू 80% ऑफ योर इनकम। Even a 10% raise in those services will zoom your revenue out of the window in terms of compared to denture, I would say. जो चीज आप करते ही कम हो उसको कम किया ज्यादा किया, anyways it is not going to make a difference. So always raise your prices selectively. ये first फंडा है. Then the second फंडा is based on the costing part. जिस चीज में जो कॉस्टिंग पड़ती है, अब कॉस्टिंग अगर आपको पता ही नहीं है, अगर आप क्राउन में सिर्फ इफ यू आर वाचिंग एट द लैब प्राइस, then you are making a huge mistake. This part I've taken up pretty much well in the costing sessions. Even for a normal PFM crown, indirect cost, direct cost मिला के, the landing cost for an average dental clinic we have calculated comes out to 1,938 rupees, close to 2,000. Let's suppose round it off. 2,000 आपकी अपनी कॉस्टिंग है मिनिमम इन अ स्टैंडर्ड क्लिनिक। जिसका क्लिनिक थोड़ा अप है उसका उस हिसाब से लैब कॉस्ट, अदर कॉस्ट प्लस इनडायरेक्ट कॉस्ट, all costs included. If somebody is charging 1,500, 1,800, 1,200 for that crown, you get the answer what he is taking home actually, माइनस में। और अगर माइनस में ही काम करना है तो फिर करना क्यों है यार, प्रोफेशन बदल लो। Everybody wants to make a profit, but if you don't want to make a profit, it is your choice. So the price upward or downward, it should never be downward. It should always be upward. So there are two key questions, as I discussed a little bit now, which will need to be answered, of course. What effect will be the price change making on the volume of sales? What will be the effect on the profit per sale? This is the general industry, you can say, benchmark, which is calculated whenever they have to calculate about calculating the cost and the profit. Because if you don't consider the volume into your price raise percentage, कि आपका impact कितना पड़ना है ना, carry home कितना बढ़ेगा आपका, then you have to compensate कि some people will drop out. Yes, there will be dropouts, but doesn't mean that all patients will drop out. Everything around us is inflationary. अभी पेट्रोल बढ़ रहा है, सब चीजें बढ़ रहा है, तो everything is going up. I remember a Navratra namkeen I used to get at 50, 60, rare case 70 rupees packet from a good shop. The same namkeen I got last week for 115 or 20 rupees. Now, I'm not comparing that to maybe the quality has changed, it was changed. I just asked him jokingly, भाई लेना तो है ही है, just asking. सर जी घी का पीपा 800-900 रुपए बढ़ गया. This was his answer. I never said I'm not taking it. I said okay, no problem. Just give me the whatever he is doing. Just एक बारी जो 3-4 चीजें ली थी उसके एक पर्ची बना दो. Whatever you are doing. So he was said. I said ये इतने का नहीं होता था. नहीं ये इतने का है सर. Because घी का रेट बढ़ गया. Now it is almost, if not double, at least you can say at least at a 40% increase, if not 50%. That is where you need to understand. ये होता है सुनहरा मौका लगा दे चौका। फुल टॉस आई है, कहीं भी मार लो। आईपीएल सीजन है, सो आई एम रिप्लाइंग इन दैट। सब कुछ बढ़ रहा है, तो आपकी भी कॉस्टिंग बढ़ रही है, तो दिस इज द बेस्ट टाइम टू इंक्रीज द प्राइसेस, स्पेशली इफ यू नो इन द पास्ट यू हैव बीन अनएबल टू डू इट। आपकी कॉस्ट बढ़ चुकी है, आपका प्रॉफिट मार्जिन पहले से अब कम है। दिस इज योर गोल्डन चांस टू हिट द बॉल आउट ऑफ द पार्क। द इन्फ्लेशन इज प्रोवाइडिंग यू विद अ फुल टॉस। ऑफ कोर्स, people don't look at this concept many a times. There are many people who genuinely increase their charges every year, but on an average, majority, I would say 70 to 80% don't even raise even once in 3 years. That is where the problem comes. So increasing prices can improve our profitability even though volume may drop. As I gave you the example of a denture, even if you increase 100%, even if you increase 100% और आपकी वॉल्यूम हाफ रह जाए, यू आर स्टिल टेकिंग होम मोर इवन विद सेम रेवेन्यू, बिकॉज आपकी कॉस्ट कम हो गई ना। 6 डेंचर की कॉस्ट पड़ती थी, अब 3 डेंचर की कॉस्ट पड़ी। सो क्या टेंशन है? सेम रेवेन्यू कमा के भी यू आर टेकिंग होम मोर। ये दिमाग में घुस जाए बात तो बहुत बढ़िया हो जाएगा। देन व्हेन यू आर इंक्रीजिंग, यू हैव टू एक्सप्लेन टू योर पेशेंट्स व्हाई यू आर डूइंग इट। In these scenarios like today's time, you don't even need to do that. Sunahara Mauka, as I said, chance pe dance. So this is the way you need to think about it. It can actually give us an opportunity as well to explain to our patients why is the value being provided in that regard. I don't want to compromise on, you can say, any materials. The material charges are increasing, the input cost is increasing, so we have to raise our charges as well. If I remember I was sitting in a friend's clinic 6 or 7 years back. So the patient, मेरे सामने पेशेंट ने मेरे फ्रेंड से पूछा, डॉक्टर साहब आप जितने पैसे 2 साल पहले ले रहे थे आज भी उतने ले रहे हो ट्रीटमेंट के, मटेरियल तो सही यूज कर रहे हो ना? हाँ जी बिल्कुल अच्छी क्वालिटी का यूज कर रहे हैं। व्हाट ही मेंट टू से वाज, आई एम नॉट रियली श्योर वेदर यू आर यूजिंग अडल्टरेटेड मटेरियल्स और नॉट। व्हाट ही डिड नॉट से वाज, 2 साल में कौन सी चीज के प्राइस नहीं बढ़े हैं और आप अभी भी पुराने रेट पे काम कर रहे हो? या तो बहुत दयावान हो, बहुत एंसेस्ट्रल प्रॉपर्टी है आपके पास, या बहुत स्लीपिंग इनकम आ रही है आपको, या फिर आपने कहीं ना कहीं से कॉस्ट कटिंग शुरू कर दी है। एवरीथिंग, if it increases, the dental treatment charges also have to increase. You need to remember that. I raised 2 charges of my services right today only by 12%, and I got an instant conversion there and then for both the patients of the same service. Of course, how you convey to the patient is also going to make a difference. Then sometimes people, you can say, hide price increase, like introduce new high price products or services and then make older or cheaper ones obsolete. For example, discontinuing silver amalgam and making composite the choice or the preferred one. सर जी पहले तो हम 4 फिलिंग्स करते थे, सीमेंट करते थे, सिल्वर करते थे, लेजर करते थे। लेजर बोलते हैं ना कॉम्पोजिट को, यू नो दैट इन मेनी टाउन्स। सो अब हमारे पास सिर्फ एक ही फिलिंग है, दिस इज दी वन। अब कॉम्पोजिट है कि अल्कासाइट है कि इट इज योर चॉइस, बट कॉम्पोमर है, तो वट एवर यू आर डूइंग, बट पीपल से अब हमारे पास वही है जी, एक है जी, टूथ कलर। दिस इज द वे दे फेज आउट अ मटेरियल एंड रेज द चार्जेस। ये अब ऑप्शन ही एक है, उसी में क्वालिटी अच्छी है। अब उसमें भी आपके पास शायद 3M का हो, डेंसप्लाई का हो, और भी मटेरियल्स हो, या एनीथिंग inferior also. Then many people indulge in bulk buying, which unfortunately has not been possible in the past 2 years. courtesy the lockdowns and lack of experience happening. This weekend experiment is happening in Delhi. Of course, it is not the full experiment. It is the Aditi North Zone event. But yes, happening in Delhi, happening in Pragati Madan. It should be at least still more than the Zirakpur one and lesser than the Delhi one. So the bulk buying option may come handy. Of course, you can have like-minded colleagues who will give you an option to buy that. As I said, the patient has to be kept in loop regarding price rise. If you're planning on a price rise, start warning the patients. Always inform your labs also prior. That whenever you're going to raise, at least inform 1 to 2 months in advance. Many a times, some conversions are hinging on that only. Some people would say, ये डॉक्टर साहब रुक के करवाएंगे. Sir, the lab charges are rising from the next month onwards, so you will have to pay a little bit more. So kindly be prepared for that. और डॉक्टर साहब 20,000 खर्चना 22 खर्च लेंगे, no problem. If it has a bigger unit or a bigger bridge or maybe more work to be done, then you'll find out the cost benefit ratio. कितना फर्क पड़ेगा? अच्छा 20 का था 28 में पड़ेगा, तो I'll get it done now only. You can have some odd conversions out of the blue happening as well when you prior inform the patient. Now, the second, you can say the flip side of this is decreasing prices. I have raised my prices, the patient acceptance was not there, so I'm reducing my prices back to normal. जो मर्जी आप लूप लपेटा करो पेशेंट के साथ, but the patient is not ready to understand that. Then I say decreasing is actually a sin, a cardinal sin, should never be resorted to. Because if you are doing that, I would say you are sinking yourself with the Chinese material. If you are not using them, it's perfectly all right. If somebody is using it, it's going to give you a bad reputation for sure. Trust me, many reasonably good clinics are also using. The problem comes there only. Low prices sometimes go in hand with poor image of the clinic. Nobody would say, oh, doctor सस्ता है. People flaunt. मैं उस डॉक्टर के पास गई थी. I'm talking of the general medical colleagues. 1000 रुपए कंसल्टेशन है उसकी. एक बार देखने के 1000 लेता है. हफ्ते बाद दोबारा जाना पड़ेगा, फिर से फीस ली उसने. But डॉक्टर अच्छा क्या करे? That is the explanation they give to us, to themselves, to the onlooker, to the one they are talking to. So patients are really smart enough. They know what is the prevalent market price. Dentist तो कंसल्टेशन लेने से भी डरते हैं बहुत सारे. ट्रीटमेंट शुरू कर दिया, चलो छोड़ो कंसल्टेशन छोड़ो. Why? 2 महीने बाद भी पेशेंट आएगा, कोई बात नहीं जी, आप पिछली बार कंसल्टेशन दे गए थे, छोड़ दो. Many colleagues do it. I'm not saying you are doing it, but many colleagues do it. Then they start sounding, हमारे अगले महीने से प्राइसेस डिक्रीज हो रहे हैं. किस चीज के डिक्रीज होते हैं आज की डेट में? प्राइसेस सबके इंक्रीज होते हैं. So this was the one we started from. Price shift in clinic, upward or downward? Of course, it has to be upward. Downward is not a question, especially in today's inflationary times. Absolutely out of the window. Is shifting pleasant? Yes, if you keep the patients in loop, prior inform. But then the logic of your raise should be based on your costing primarily. You should need to understand the costing part very clearly. I have made those videos, series of 5 videos of costing. For any person who does not even understand or even hates maths, understand the basic statistics, I would say, or hates math, he also can understand those videos. When I did this session, I made my WhatsApp group members follow this funda, and they came up with their own costing, and their session was recorded and with their permission put up on YouTube as well in the same video. Along with me, they presented the same. So if they can understand, you also can understand. Do we have to be fearful? Not everyone walking through your door is your patient. You always win some, you always lose some. Calculate how much is the drop vis-a-vis the raise in the margin of the sales. So why don't dentists take the upward step very often? Because they are in their comfort zone falsely believing that their patients come to them only for prices. I mentioned 8 or 10 other things for which the patients select you. Of course, sometimes price is a composite factor in those 10 factors, but it is not the only factor. For a very poor patient, class 4 patient, you may say price is the criteria. But for a normal middle class, upper middle class, super rich class, price is not the criteria. He look at the criteria. He is very highly priced. Does the ambience, does the treatment planning give me or mentally accord me the value of the same? जो 10 रुपए खर्च रहा है वो 10.5 रुपए एक्सपेक्ट करेगा मिनिमम. 10 वाले को लगेगा 10 दे के मेरे को 9 वापस मिल रहे हैं, he will not choose you. और हमारे को लगता है कि प्राइसिंग में क्राइटेरिया था. No. Get out of your comfort zone. That is the bottom line. The bottom line is we should concentrate on building profits rather than cutting prices to push up sales. वो पुश अप सेल्स, वॉल्यूम बेस्ड सेल्स वो करते हैं होलसेलर. आप होलसेलर नहीं हो भाई साहब. You need to understand very, very clearly. Patients select us for our value added services. And thinking that patients will pick only the right price, I'm sorry, nobody wants to risk their health. So जब आप वैल्यू दे रहे हैं तो चिंता मत करिएगा. There will be always some people जिनको आपका lowest rate, if you are the lowest price in your area, there will be some who will find that low price also very high. बहुत महंगे हो आप तो. One of my colleagues who is charging 1500 for a PFM crown asked me, यार मैंने पेशेंट को बोला 1500. कहा तू पहले 1500 ले क्यों रहा है? तू मेरे व्हाट्सएप ग्रुप में है, तू मेरा दोस्त है, तू कितने साल से काम कर रहा है. ऑफ कोर्स ही इज जूनियर टू मी बाय 7-8 years. 15 साल से डेंटिस्ट्री तू भी कर रहा है, बट व्हाई आर यू चार्जिंग 1500? यार पेशेंट देते ही नहीं है पैसे. तो तुमने मांगे होंगे तो देंगे ना. When I tell him when I started my clinic 22 plus years back, I had the starting price of PFM crown 1500 rupees at that time. I was not an MBA then. I had no benchmark. I had no one to guide me in this matter. The only thing to guide me in this matter was my hospital where I was working. I was working in a charitable hospital, Guru Tegh Bahadur Sahib Hospital. And that charitable hospital was charging rupees 1500 for a PFM crown in the year 1999. So when I started on 1st Jan 2000, I kept the same price in my clinic. और अगर आज उस घटना ही कहूंगा 22 साल प्लस 22.5 साल होने वाले हैं के बाद somebody is still charging 1500. Remember at the start of my presentation I told you एक PFM crown की एक एवरेज क्लिनिक की कॉस्टिंग डायरेक्ट इनडायरेक्ट लैब एवरीथिंग मिला के 1900 समथिंग, ऑलमोस्ट क्लोज टू 2000 पड़ती है. So that guy is putting 500 from his pocket and not taking anything home from that crown. If you are sure that you're providing the best service along with the value, but yes, keeping the patients in the loop, never relent from the price. You will have occasional less sales, occasional less profits, but creating awareness amongst the patient is more important. Tell the patients about alternative and how they compare. And cost, why are you costly? Need to tell that. So this is the, you can say, carry home Gyan for today. I hope you have something to take home from today's session. And if I have been able to put you in think mode, I would be very, very happy. बाकी जप नाम अगर आपकी नींद खराब हुई हो मेरी वजह से, तो as usual my favorite series. So this is the workshop that I'm doing from next week onwards. So this is a 2-in-1 workshop. I used to have a consent workshop separately and a record keeping separately. On public demand, I have merged these two things to make a, you can say, a bountiful workshop, which has enormous amount of content for routine use. It is going to be 1 month long. one workshop of pre-workshop homework, and followed by every alternate day 3 sessions each week for the next 3 weeks, plus one query session. So total plus one introduction session. So total of 11 sessions in that. Of course, maybe a little bit more. If you want to come on board, you can be a part of it. The dates are 18th April. It will be in the afternoon from 2 to 4, 2 to 5. The schedule is mentioned over here. And if you miss the live, you will have the recording access. The support is there. It will happen in the FB group only. So you can come on board. If you don't want to, it's perfectly all right. But consent is one thing I took up last week. I hope you understood why it is important. So thank you so much. And this is the WhatsApp community that I'm running, planning to shut it down after the 6th group. So the 6th group is already on and nearing completion. So you can, if you want to be added for an advertisement-free group for purely for education, to come on board. So this is my YouTube channel. As on 31st March, 440 plus videos are already there. To go to the channel, subscribe to the videos, and you will get to be notified when I post a new video. Do send me your feedback wherever you're watching it, on my page, on my WhatsApp community, on YouTube, wherever you'll be watching it. Bookers and Brickbats both will be welcoming you. Thank you so much once again, and I stop my share for questions, if any, or surely acknowledging the visitors on my website, on my page, where this session is happening live. Hi, Dr. Vrinda. Hi, Dr. Amit. Hi, Dr. Ramchandra sir. Hi, Dr. Rajinder Desai. Hello, Dr. Manu. Hi, Dr. Nimish. Hi, Dr. Manoj. Hi, Dr. Larissa. Hi, Rids. Yes, Chance Pedance. I spoke this word. Yes. Hi, Ananya. Hi, Dr. Parul. Thank you, Dr. Ramchandra. Any questions if you have, please feel free to voice them. I'm here for 2 minutes, or else we break for today. So any questions, if you have in your mind, please feel free to ask. Okay. Okay, guys. Thank you then. Have a great week ahead. Thank you for watching this. And I hope I was able to put across something useful for you guys. So bye-bye. Take care. Have a great day and a great week ahead.